Hello and welcome to spending an hour of my birthday with me. On this live, I'm going to be sharing with you areas for paper 1, paper 2, OSCE, and VIVA. I'm currently trying to get my phone to present, but I'm not saying it. So I'll just go ahead. So I'll just go ahead and start. All right, hello. Thank you so much for those that wish me happy birthday today. I really appreciate it. It's not taken for granted. All right, so I'm going to just basically brush through this. I might not spend up to an hour as I intended to. So what is NMCN exam? NMCN exam RN basically contains 3 papers. We have paper 1, paper 2, paper 3. Paper 1 objective, paper 2 objective, paper 3 is OSCE and VIVA. Now, paper 1 being objective, you are going to come across 250 questions. Same with paper 2. Then for paper 3, your VIVA totally depends on your examiners, and the areas where questions are asked from in VIVA I would mention later. For your OSCE and VIVA together is over 100. For you to pass RN exam, you need a minimum of 50% in each of the paper. Now for your paper 1 and paper 2, like I said, it has 250 questions. So for you to get 50%, you need to get a minimum of 125 questions. But like I always tell whoever that comes to me for advice, I'll tell them to aim to get 200 correctly. And when you start your paper 1 and paper 2, if you meet a question you don't understand, move to the next one. Because if you try to answer and say you will get back to it later, the structure of the exam is if you click an answer, it changes color. That particular column changes color. So once it changes color, you would not be able to quickly locate the ones you've not answered. So, but if you leave it blank and you move on to the next one, the ones that you've not answered, you will clearly see it. So when you've gone through the 250 questions and you skipped the ones you didn't necessarily know the answer, you'll be able to easily know the one you've answered. So like I mentioned earlier, you need to get 125 questions correctly for you to pass, but always target to get 200 questions at the barest minimum correctly. Then before you see the submission button, you must have answered 80% of the question. Now, the tips I'm going to give you for paper 1 and 2 is that skip and return if unsure. So when you skip, it's going to be easier for you to get back to the ones you've not answered. Manage your time carefully. This 250 questions is for 3 hours, and 3 hours is 180 minutes. That means you literally have like less than a minute to answer a question. So once you read a question and you cannot really get the answer, or when you scroll through, like you have 4 options, right? 2 options will definitely not be correct. 2 options will look similar to each other. If you cannot quickly decide which one of the 2 it is, move on to the next one. So by that way, you're managing your time. Don't rush submission. You read everything I'm about to mention. Read every topic I'm about to mention. So for your paper 1, the course areas I should expect questions from are anatomy and physiology, psychology, anatomy and physiology, medical surgical nursing, foundation of nursing, public health care, nutrition and dietetics, community health nursing, home health care, management and teaching. The areas you should expect questions from for your paper 2 are also anatomy and physiology, mental health nursing, reproductive health, emergency and disaster, nursing research and statistics, medical surgical nursing, health economics, politics and governance, nursing informatics and management. Now, each of these areas, right, for paper one now, the areas I listed, you can meet them in paper two. The areas I listed in paper two, you can meet them in your paper one. And mind you, you might not even meet any of the areas in either paper one or paper two. But the best thing for you is just to prepare for all of it. So if you don't know the areas that questions normally come up from, now you know. Now, questions on anatomy and physiology normally comes in diagram format. You'll be given a diagram whereby you'll be asked to label. So you might be they might label like A, B, C, D, and be like, part label C is called what? Or the part label C functions as what? So they might not necessarily give you the name of that part, but they might ask you for the function. And the only way you can know the function to that thing is if you already know what it is. So when you're taking note of the anatomy and physiology for each of the systems, make sure that you learn all the diagram and you know their labelings. For medical surgical nursing, this normally comes in form of case scenario questions where they want to test your knowledge on what you would do as a nurse if you are in charge of a ward. So they'll give you case scenarios like, if you're in the ward, maybe you're doing blood transfusion, for example, and the patient is reacting, what is the first thing you're going to do? That is a case scenario question. So they'll give you 4 options. Normally, the first thing you're supposed to do is to stop the blood transfusion. Then you proceed to there is this depending on the reaction of what the patient is reacting to, depending on what the patient is showcasing to you, will determine your next steps. So most likely the WASCO will be the first step, stop the infusion, inform the doctor. They'll give you 2 other options that of course will not be the answer. So your answer would be stop the infusion. And don't forget that medical surgical nursing always cover the disease processes, the pathophysiology, signs and symptoms, your nursing and medical management. So if you're presented with a particular disease, you're expected to know how that disease works, like how does this disease occur? That is your pathophysiology. And if you know the normal functioning of a particular organ, you will know how that disease affects it and how all those clinical signs and symptoms showcases. So all these areas that I mentioned, I always and highly and will continue to recommend explicit textbook. So using explicit textbook, take each of the systems one by one. You note their anatomy and physiology. You note each of the diseases, know their pathophysiology, their nursing and medical management. That way, if any of those diseases come out in your exam as case scenario question, you'll be able to know what to do, be it pharmacological approach or your nursing approach on what to do first, and also know the clinical correlation. So that's basically it for paper 1 and paper 2. Now for paper 3, which is VIVA and OSCE, I'll start with VIVA. So what is VIVA? VIVA is a one-on-one interview that you have with your examiner, and it lasts for 10 minutes. The areas questions are normally asked during VIVA are models, instruments, drugs, projects, and case study. These are the 5 major areas that questions are normally asked. Now, outside of these 5 major areas, they might ask you questions like, how are you? Why did you choose nursing? Just a regular conversation, depending on the examiner. So now that one of how are you, I'll give you the template later. Now for models, if you're what are models? Models are all those like plastic physical demonstration of how a human organ is. So when you're given a particular model or you're asked to go pick a model, how are you expected to answer question on them? You must first of all identify the organ, that this is the organ of a stomach. Then you now define what is stomach, and you state the location, the system relation, you state the size, the shape, the function in that order. Then you state the relations anteriorly, posteriorly. Then you talk about the physiology and clinical correlation. Okay, so this is the way to answer questions on models. If you are asked question on models in your exam. But if it's instrument, if you're asked to go pick an instrument, because instrument is also a common area questions come out from for VIVA, you pick it up, you name it. This is the instrument. This is artery forceps. Explain the usage. It is used to do this. You demonstrate it as you're saying it. You demonstrate. You state the significance to patient care. These are the 5 major things you are expected to do if you're asked question on instruments. Now for drugs, if you're given question on drug, you have to first of all state the classification. Then you state the route of administration. You state the side effects, the mode of action, indications and contraindications. You state the nurse's role. And if there is still time, you state the rights of drug administration. These are what is expected of you when you ask questions on drug. The question does not pass this. Mind you, the examiner might just ask you what is the side effect of this drug and just go straight to what they want you to tell them. But most times they don't. They'll just give you the drug and then they expect you to start talking on it. So if you are stuck on it, this is the method you are to follow. Now, the last thing they normally ask that questions can stem up from for VIVA is project and case study. So for your project, you're expected to know your objective, know your topic. Know your topic, very important. They want to know if you're the one that did it yourself, if you truly picked the topic. And if it's you that did it yourself, of course, you're very conversant with your topic, word for word, because if you skip a word or you skip a comma, they will know that you're not the one. So know your topic, master your topic, know your objective. Know the reason you picked that topic. There should be a story behind your project topic. There must have been something that you saw, something that inspired you. Know it. They might ask for project. Then you state the challenges that you faced while carrying out the project. Is it you could not find the was it language barrier, was it transportation barrier, was it financial barrier? You state the challenges, and if you did not face any challenge, oh well, you stated that you didn't face any challenge. Then know your theories and how it applies to your project. Okay. Then the population as well. You have to tell us how you came about your sample size. There is a general population in a particular place, and then there is sample size. Tell us the formula and tell us how you got your sample size. Then your recommendation and what your project tends to, the implication to nursing, and how it tends to solve the problem. So these are the things they ask. Most times, the examiner might just ask you, what's the objective of your project? What are the challenges you faced? And sometimes you might just say, okay, talk about your project. So these are the things I expected of you to talk about if it's project. For case study, you are expected to know your patient's information, the anatomy and physiology of the disease, the definition and the nursing care that you rendered, especially your nursing care plan. Now, extra tips for VIVA. When you're speaking, don't speak too fast, don't speak too slow. Like I said, it's 10 minutes, so you are expected to answer as much. If you talk too fast, you might not say enough for the examiner to mark you enough. And if you talk too slow, it gives them an avenue to keep questioning you. Sorry, if you talk too fast, it gives them avenue to question you. If you talk too slow, you don't say enough for them to give you good mark. So don't talk too fast, don't talk too slow. Then avoid pointing with fingers. Use your pen, especially when you are asked questions on models and maybe there are arteries and veins that you want to point at. Don't use your finger, use your pen. Know your common models, your drugs and instruments. Be ready for personal questions like why nursing. Sorry about that. Now, getting back, I'm going to be going to OSCE. Now, for OSCE, we have general rules. The general rules include backing your station once you enter, When you enter, you back your station, you greet your examiner. Once you are to start, once you enter, before they say start, just back your station. Then you proceed to greeting your examiner. After you do that, and they say start, the first thing you have to call is your exam number, not your name. You read your questions out loud before you start. Then you greet and introduce yourself to patients. Introduce yourself to patients. Then you explain the procedure and gain consent. After, you provide privacy and ensure you wash your hand, arrange your trolley. Most times it's always arranged, so you don't need to do that anymore. So you provide, you wheel your trolley. You say it most times that this is what you are doing. So after that, you now perform the procedure. After performing the procedure, ensure you end it with documentation. Even if time is up, always say I document. And it's very important for you to state what you're documenting. You document the name, the procedure, the time in which you carried out the procedure, and what you notice. Another importance of another importance of reading your question out loud is for you to understand. Because if you have to carry out the procedure, most times they will tell you to health educate. And if you like health educate and you don't end up carrying out the health education aspects, you lose mark. Okay, so always act as if you're performing your procedure in real life. Speak your actions. Don't say I will. Say I wash my hands. Okay, then call for assistance for procedures that need assistance, and don't forget to document. You document patient name, the procedure, the time, if there is any reactions or anything you see. The general exam advice I have for you is that believe in yourself. Okay, time management is important. Stress management is important. Make sure you manage stress. Yes, you're under pressure, you have a lot of things you want to do. Of course, the stress will come in. So manage it well by sleeping and having a good study habit. Know when to start studying. Build a daily study routine. That way you are good to go. So I'm going to be ending this live by saying success is when preparation meets opportunity. Success is when preparation meets opportunity. So I wish you success in your RN exam. If you have any questions based on what I said, you can leave it in the comment section below. You can also message me on Fabnursing on TikTok, on IG. If you're on LinkedIn, you can message me at Folusho Adedoku or on Facebook. I would be there to answer your question. And all of this, I've actually, like I and two others, I've compiled it in an ebook. So if you would love to get a copy of the ebook, you can, comment ebook and I will send you the link, or you can look through the bio and you are good to go. So bye for now, and thank you for the birthday wishes. That's for those that, wished me. God bless you, and bye.